I think there are a few main takeaway points, but I think one of the main point is also to think about, as I spoke earlier about that systematic approach, but also think about these broad things, tips and clinical perils. For example, when you think about the brain, we always think about unilateral symptoms because it comes from the brain, it crosses and very elegantly it's controlled the other side. When we think about the spinal cord, most of the time we have bilateral symptoms. So that's, I think, like step one almost, that you want to think about it. And then you can think about some perils related to the face, facial perils, about how to differentiate between a brainstem, cranial nerve 7 palsy versus the brain, the parenchymal. Or you want to think about visual acuity perils that you think about. If you have visual acuity and field cut, it's coming above the brainstem. But if you have diplopia, double vision, or INO, internuclear ophthalmoplegia, it's coming from the brainstem. So you can I think make that level. So I think that's one of the points that I would like to make, that I think that it's important to think, what do we see in patient? We see vision issue, we see facial issue, we see spinal cord issue, and we need to be aware that most of the time when you think about spinal cord, everything, when you have a level of injury or lesion, it's usually affect everything below. But the tricky thing is that C2-3 also innervate above the skull. So we need to know that piece. The other thing is for clinician to always, number one, think about localization, because it helps us, number one, to come with a better etiology. Number two, we order the really appropriate and necessary diagnostic test and not everything under the sun. Number three, it directs us to proper treatments, because if we have the proper etiology and thinking about accurate and suitable diagnostic tests, we can think about treatment. And lastly, prognosis. Patients want to know what they're dealing with, what the diagnosis, what is my prognosis, although sometimes it's hard for us to see the future, but we have some factors that can help us, some prognostic factors that can really assist us. So I think that's the main, I guess, key point, if I can summarize it.